Hospitals in Sichuan are trying their best to help COVID patients as the province is still facing increasing infections. The West China Tianfu Hospital has integrated all its departments by consultation or sending medical staff to each department to help patients even if it still faces some challenges. The pressure on the emergency department has sharply increased this month, but before that, there were only about 50 to 60 patients every day. But this week, especially on Wednesday, the number was over 400. But medical staff are still working together to help patients.
We opened 2 clinics for patients. Next, we'll open up more. We had 8 doctors before, but as the number of patients rises, our hospitals send more doctors to our department, and now we have 23. And all departments are receiving COVID patients from us, so there are few in our department.
Director He says most COVID patients are seniors with basic ailments. Once they are in critical condition, they would be transmitted to the intensive care unit, or ICU, in 24 hours, which has over 180 medical staff, including 40 doctors and 120 nurses. Every patient has a single room here.
We expanded the sick beds from 20 to 40, but on December the 24th, we were all occupied, so the next day we expanded 20 more. We have 60 invasive ventilators and 20 non-invasive ventilators for patients, which is enough. So far, we have received about 60 COVID patients, and over 10 of them recovered and left our unit.
The Respiratory and Critical Care Medicine Department is one of the main departments to treat COVID patients, and the doctors also gave the hospital good advice in working together to deal with rising infections.
We have suggested and reached a consensus that COVID patients can be divided into 4 types, and they would be treated by surgical departments, non-respiratory internal department, respiratory department, and ICU based on their conditions.
Liu said so far the hospital is capable of dealing with the patients, and he has also written some medical instructions for the surgical department so they can cope with COVID patients more efficiently.